Joining us today is Dr. Theron Stinar, CEO of the Fredericksburg Christian Health Center. FCHC is our local nonprofit ministry right here in Fredericksburg, delivering compassionate, Christ-centered healthcare to those in need, healing the whole person, body, mind, and spirit. As the beneficiary of our upcoming Wolves at the Gate concert on May 2nd, it is important to learn more about who they are and how they're making a real difference in our community.
Well, hey, thanks for listening in. We have Dr. Theron Stinar from the Fredericksburg Christian Health Center with us. And I'm happy to have you here. Can you tell us a little bit about the Fredericksburg Christian Health Center?
Yeah, thanks, Andy. So Fredericksburg Christian Health Center is a nonprofit healthcare ministry that was established in 2003. So we're on our 24th year now. And we take care of patients who are uninsured, patients who have Medicaid, or just have an insurance that doesn't quite cover all their needs, as well as patients that have regular insurance and Medicare also. So about half of all the services that we provide at the clinic are charity care.
Now, you started the Fredericksburg Christian Health Center started back in 2003, and then
Correct.
You started with it in 2017. So how has the vision grown from its early stages to now?
Yeah. So Dr. Tim Powell started the clinic in 2003, and it was just a primary care clinic. He was at another just for-profit clinic in town and saw that there was a lot of people in the community that just no one was taking care of. Moss Clinic was in place at that point. They'd been around for maybe a few years, but there's still a huge need, and no one else was really taking care of these patients. And God had put it on his heart to go into medicine as like a medical missionary, and felt like, hey, he could do that right here in his hometown. He didn't need to go to a third world country. There's people that were hurting right here. And so that's how we started Fredericksburg Christian Health Center. And again, at that time, it was just generally primary care. I joined the clinic in 2013. And then in 2017, Dr. Powell kind of stepped away to a partial retirement, wanted to finish his career teaching at a residency program. And so I took over in leadership at that time. And right around that time, we had started thinking about looking at some other services. Partnering with nutrition was our first one. So we started adding nutritional services right around that time, 2017, 2018. And then we added behavioral health services. So now we have in-house counseling. We have a contract psychiatrist that we partner with. We have mental health case management, as well as the nutritional services, which is both. Initially, we started partnering with dietitians to do nutritional education with patients, especially patients with diabetes. And then now we've expanded also to partnering to do food distribution. So with our local food bank, with an organization called the Virginia Community Food Connections, which gets donated fresh produce from local farmers that we can distribute to patients. A lot of times if someone goes to a food bank, they may be getting canned and boxed food, which is certainly better than nothing, not always the most nutritious, but they can almost never get fresh products. So now we can get them fresh stuff from local farmers. And then we have several churches that partner with us also and donate bags of food, along with the food from the food bank. So we did that. We started behavioral health. And then almost 4 years ago, we started a program called our Health Bridge program. And that's where we actually go outside of the clinic and provide healthcare services in the community in collaboration with some of our community partners. So we started with Micah Ministries, which is a ministry that takes care of unhoused people mostly in downtown Fredericksburg. And so we'll go to Micah Ministries office, and we'll also go to some of the locations where some of these people are receiving temporary housing, generally through Micah Ministries, and provide visits right then and there. So these patients who have transportation problems or just other social issues where they might not feel comfortable or have the ability to really just kind of go into a clinic and get care like you and I would, we can go directly to them and provide care for them in a way that a location they're comfortable, people they trust. We build a relationship with them and they trust us, because a lot of people have been hurt by the healthcare system and have been treated poorly because of their situation. And so we started doing that initially with Micah Ministries, and now we provide those same services with Empower House. We've been doing that almost 3 years now, which is an organization that takes care women and children who are victims of domestic abuse. So we'll provide on-site either at their safe house or at their main office. And then we also do it with two organizations that take care of people who are recovering from substance abuse. So Zoe Freedom Center and Beauty for Ashes. And both of those ministries have residential houses also, where with Beauty for Ashes, women and children, with the Zoe, women can stay for a year or more receiving treatment and just a safe place to be as they recover and learn what life is like free of addiction. And
Wow.
so because these women are in these programs that are residential programs, for them to go to a doctor's appointment requires staff from these other locations to bring them, or the women who are in a safe house with Empower House, it might not always be safe for them to leave, right? And so we can go to them and provide the services they need.
That's really, really special. It's kind of meeting people where they're at.
Exactly.
Literally and figuratively, every way you can imagine that, just going and doing those things.
Yep, exactly.
On your website too, it talks a lot about being the hope and healing of Christ to
Yes.
neighbors in need.
Yeah.
What does that look like on a day-to-day basis?
Yeah.
How is it different than just normal going to the doctor?
Right. Yeah. So for the services that we provide in-house, if you are one of our patients, again, whether you have insurance or not, we treat everyone the same. We treat everyone with a high level of quality of care, particularly if you're someone that does have financial constraints or is uninsured. I think one of the great things is you walk into our office and you do get treated the same, right? You get treated with a level of respect that you might not always get at other places, and you can come in and be seen. And then the two things I think that helps distinguish kind of the care that we provide just in general, our medical care, is that we take a holistic approach. We look at body, mind, and spirit and see how your health is all of those things combined. It's not just your physical health, it is your mental health and your spiritual health as well. And when any of those areas is not doing well, the other ones are going to suffer also. And it could be as simple as, let's say you have diabetes, but you're feeling really depressed. And so it's hard to be motivated to eat healthy or exercise or remember to take your medicine or remember to check your blood sugar. And we need to treat that depression also to help your blood sugar as well, and your spirit, your soul's not going to be doing well when you're either physically feeling bad or emotionally doing bad, or maybe you're, one of the reasons you're feeling bad is because your soul's not doing bad, like they all interplay with each other, right? And so we take the time to really talk with our patients and to get to know our patients, to build a relationship, so I can understand, hey, what's really going on? I noticed your sugars, saying you have diabetes, I noticed your sugars have been going up the last few months. How are things at home? How are things at work? Why was it that you were 3 weeks late filling your prescription for your medicine? Were you having trouble affording it? Is there a way we can help you with that? Am I giving you a medicine you can't afford and we need to change that? Let's have a conversation. And we try to build that relationship so our patients feel comfortable being honest and vulnerable, because it's your health. And when we talk about those things, it can be vulnerable. And so we want to really take the time to get to know people, to let them know that we really do care about you. You're not just a number. You're not just, a bill that we can bill to your insurance company and, get paid and I can, have a yacht somewhere or whatever, that's not what we do as medicine. We want to take care of people. And then on the spiritual side of that too is, as we develop a relationship and you realize I really do care about you, it opens the door for, if there is something going on, or one of your parents passes away, or you lose your job, or something happens, or even when things are going well, I can say, hey, Andy, would you mind if I prayed with you? Could you use some prayer over this? And sometimes patients will actively ask that, or our conversation will lead to something spiritual, and we can care for the soul and do spiritual care in that way also.
Yeah. So the report I read said that the center as a whole prayed for over 900 of your patients. And that was completely voluntary. It wasn't forced upon them.
No,
they asked for it. And that's really
Yeah.
insane number.
Yeah.
So
Yeah.
What's it like when you get to stop being the doctor and start being just a spiritual friend for a minute?
I mean, honestly, like that's my preference. It really is. It's Jesus. One of the things Jesus did the most in the Bible was heal people, um, and I and, yeah, and I don't think you have to be a medical professional. Like I just want to say that out there that like I believe that a gift of healing or even a gift of compassion, like it doesn't matter what your occupation is. The Holy Spirit can do whatever He wants. But because of my occupation, I have the opportunity to care for people and to be with people during times in need. And that's like the most special thing, because one, I do enjoy that relationship with my patients, but I feel like I'm helping the person the most in those times. And certainly there's times where we've really taken care of someone's medical problem, or a mental health crisis, and really that patient could look to that thing and, man, I was on the verge of having a heart attack, or I was feeling suicidal, or whatever, and you guys really helped me. But at the same time too, like, and it is voluntary, with praying with patients. We never force it. We see people of all religions. You don't have to be a Christian to come to our clinic. And then we always ask, everything in medicine has to have consent, and we believe this is care. We're providing this is spiritual care. It's part of what we do. And so we need your consent. Just like I went and cut a mole off you, or inject your joint,
That's right.
or prescribe your medicine without you saying, yeah, I want to do that. So always ask, hey, would it be okay if I prayed with you? 9 out of 10 times, people, yes. I have patients at this point that, maybe I'm running a little behind, and I'm trying to end the appointment, get out of the room. Dr. Stinar, aren't you going to pray for me? It's like, yes, I will. Yep. Even though if I'm behind, and so a lot of them now, I can't get away with not praying with them. But I think it helps so much. And we've seen, I mean, we could talk for a while, but I mean, literally have seen people that they had an MRI or a scan and it shows a tumor, and we pray for them, and they get, another study a few weeks later, a month later, and it's gone. And the radiologist has no explanation. They look back, yep, it was definitely there last month. It's definitely gone now.
Wow.
We didn't do anything to treat it. Yes, we did. We prayed, but, stories like that, people who were certain they had appendicitis and then it's gone, or, people's pain, certainly emotional things, and just even reconciliation, praying for people's relationships, with spouses or estranged kids or work situations. It's that's the part that's the best. And it's not like we see that with everyone. I'm not going to sit here and say like, oh yeah, everyone I pray over is healed. Like, that is not the case. And it's nothing in me. It's all God. But if I pray for 900 people a year, we're going to see some of those really cool things.
That's right.
And if we don't pray for them, we're not going to see it.
I think this thing had.
I heard something.
It's back on, man.
Okay. Hopefully, I was trying to look at one of the other cameras every now and then too, to.
This could bring.
Yeah.
Yeah, so since opening, the records show that you had over 700,000 visits, and those are compassionate visits, and which equates to about $8 million in charity care. What do those numbers look like in those real human stories? Like we talked a little bit earlier about how you get to pray over people and you get to see them, but have people kind of gone through, they came in broken and came out healed, but then also their lives are better because of it.
Yeah. Oh, certainly. Sometimes people have different perceptions of someone that's in need, and most of the patients that we're taking for that are in need are people who are working. Right now, someone that comes to mind is a guy that owns his own landscaping business, right? Can't afford health insurance, he's been on our uninsured program. When Virginia expanded Medicaid a few years ago, he was eligible for Medicaid. And actually, I think at this point he'll be eligible for Medicare getting pretty soon. But we've been taking care of this guy for 20 plus years, right? But yeah, cuts grass, can barely pay his bills, can't afford insurance, and believe it or not, having a hard life, manual labor, gets bad arthritis, right? And has all the problems in life that we all deal with, and especially when you're really financially constrained, um, and so, yeah, imagine you're in that situation and you're in pain, you have to do your job or you're not going to pay your bills and you're going to be evicted and you're going to be on the streets or whatever, and to be able to, give that guy a joint injection or get him into an assistant program like through UVA where he could get his knee replaced, for free. We can't do everything. We're a primary care clinic. I can't do a whole lot of surgeries or anything. But there are other avenues out there that we can help navigate people into to get the care that they need. And so, that's a good example. We do a lot of diabetes management, and so that's a big one. And again, being able to get people medicines that there's no way they'd be able to afford. And if they didn't have the care that they receive from us, they'd be in and out of the hospital, every other month, with their sugars or their blood pressure sky high or having a stroke or, things like that. And then, yeah, really you can't work or take care of yourself or take care of your family. We see a lot of patients that are immigrants that, come over and they're not eligible for Medicaid or even sometimes private insurance right away. And there's a time period where they don't have any care or they're paying out of pocket for everything. And when you just come into a new country, you don't have all the resources that you need. You're still trying to navigate a whole new culture and maybe a new language, and to be able to provide those resources and provide a safe place where they know that it's safe for them to get the care that they need, that they're going to be respected, they're going to be treated well, and that we have systems in place where we can take care of them. So, yeah, and we'll have patients too where it is that someone that maybe does have cancer. A lot of the patients that don't have insurance haven't seen a doctor in years or decades, and they come in and they do tend to have a lot of problems, and we can't always cure them all. Sometimes someone might have cancer and it's already started to spread, but at least they have a place that they can call their medical home, that we can take care of them in the meantime. We can make them comfortable. We can take care of the things that we can, and they don't feel like, oh, I have no place to go if I feel sick, or I have to go to the ER for everything and maybe not get treated well and still get a big bill and have to fight to get it written off. And
yeah, that's hard. And it's harder lately because you mentioned the Moss Clinic earlier, and I know that recently closed down in 2025, and then also the reductions to Medicare, Medicaid. What's that all kind of doing to your environment, and how is FCHC stepping up to kind of meet those needs?
Yeah. I mean, that was a huge blow to the community last year when Moss Clinic closed. Kind of at their height, they were providing probably over twice as many primary care services as we were, and then they had a whole dental service also. They did some behavioral health also, and had a huge pharmacy service too. So it was a great partnership that we had with them, and even between the two of us and some other safety net clinics that have come up over the years kind of in our greater region, we still weren't taking care of half the people that needed our help, but yeah, when they closed, that was huge because we had hundreds of people that were uninsured that, were going to struggle to have a place to go. The main other safety net clinic in our region is a federally qualified health center, so it means their funds are primarily from the federal government. And at the time the Moss Clinic was closing, there's a lot of uncertainty about that funding. At this point, I think they're in good shape, but yeah, so we hired one of the nurse practitioners who was at the Moss Clinic. It was actually their only staff clinician. Other people were volunteers, and we also hired one of their receptionists and one of their nurses so we could take care of those patients, and those patients would recognize faces. It would be the medical provider that they were used to, and we were super blessed because these women are awesome women of God who are right on board with the mission of our ministry. And so it's been a great partnership in that way. And we're still kind of trying to navigate, you know, it feels like every month there's uncertainty about which way the government's going to rule on different things with Medicaid. But we're prepared to take on more patients as they come on, you know, as if people are losing their insurance or they're not able to afford, if they're on like an ACA plan or something like that, we're available to try to take care of people. But yeah, it's hard. And even, you know, someone who has Medicare, even someone who has private insurance, if you have a high deductible plan and you're barely making ends meet, you know, it can be really hard. A lot of our Medicare patients are people who were on our uninsured program 10 or 15 years ago. They've aged into Medicare, but they're in the same financial situation they were in when they were on our uninsured program, you know, and they've got a very fixed income and high deductibles. And so we still do a lot of charity services for patients that you might not think of as like a traditional kind of charity type of patient.
Yeah, that's when you start to really think about it, there's a lot.
Yeah.
Especially if you start looking around your own community, you start seeing all the people that, you know, maybe you overlooked the first time, but then you start to think about it, and you're like, wow, not only are they panhandling or they're, you know, they're looking like they're working dead-end jobs, but like there could be some health effects that they're not getting treated because of that.
Absolutely.
So I mean, I think the what you guys are doing is super important, and I'm glad you guys are fighting the tide here. But what are some ways that we can partner with you to kind of make sure FCHC kind of continues this amazing ministry?
Yeah, no, absolutely. You know, I'd say the two big ones are prayer, because we could always use more prayer, and of course finances also. You know, we are a nonprofit clinic, so a good portion of our income, about half our income, is going to be coming through either grants or donations. And for us, it's about 50-50, that actually a little more on the donation side than the grant side, you know, but we tend to need to raise or get granted close to $1 million each year to be able to continue to do what we do. So certainly any sort of donations, you know, big or small, are definitely received with gratitude and are necessary for us to be able to continue to do what we do. And with the prayer part too, just wisdom navigating our broken healthcare system and our place in it, and how can we expand our services and continue to reach people that are being unreached, those that, you know, often as Christians we might think of as the least of these, you know, like how can we reach those people and identify who they are, figure out what their needs are, meet their needs in a way that is best for them, you know, not just convenient for us. And then as we add services and we change our approach, it's like, all right, well, how do we do that in a way that's financially sustainable, right? And so that's always the balance we have, and it's tricky because you can't do it all. There's so many needs out there, and we're so thankful for our ministry partners in our community. There's so many other nonprofits doing really awesome work that you know, we continue to look for ways to partner with them. So if you're part of an organization, or, you know, we're an organization that, and everyone has healthcare needs, right? So if the needs of those people aren't getting met or not getting met well, we're happy to partner with them.
That's awesome, yeah. That's one of the reasons what we've decided to do is to make our upcoming concert with Wolves at the Gate, Bloodlines, and Heal the Hurt to be a benefit concert for the Fredericksburg Christian Health Center. So 100% of the net proceeds from this event are going directly to FCHC, and hopefully we can kind of sell out the crowd and get you all a big check to keep doing what you're doing.
Yeah, I appreciate that so much, and we'll have a good time too.
It's gonna be a great time.
It's gonna be a good show.
But,
Thank you for listening in and learning more about how the Fredericksburg Christian Health Center is bringing compassionate, Christ-centered healthcare to our neighbors who need it most. If you want to support this vital local ministry, please visit www.fchc.us/make-a-donation. Remember to get your tickets to see Wolves at the Gate with Bloodlines and Heal the Hurt live in concert on Saturday, May 2nd, at Grace Church of Fredericksburg. We'll see you there.